Hello, everyone, and thank you for being here. This is our next series for the Center for Health Equity, Social Determinants of Health. Today's focus is food insecurity and how that impacts our students. I will let our guest speakers introduce themselves. Dr. Ang, if you would like to go first.
Hi everyone, my name is Yen Ang, and I work as the Assistant Director for the SNAP Act program, or in California we call it CalFresh, Healthy Living, which is the largest federal food assistance education program in the country. So our aim is to provide resources to empower especially the low-income community, vulnerable populations, to empower them with the knowledge and skill sets so that they can live a healthy lifestyle despite their low income status. And so I'm very happy to be here this evening to contribute to a conversation about health equity.
Thank you so much. And Dr. Malik, would you like to introduce yourself?
Yes, thank you for having me. My name is Dr. Neil Malik, and I'm faculty within the Health Science Department here at California State University, San Bernardino, where I teach mainly in the nutrition program.
Thank you both again for being here, and I will go ahead and get started with our questions, and I'll refer to each of you as we start. So my first question is, what is food insecurity and why is it a social determinant of health? Dr. Ang, if you would like to go first.
Okay, I think first of all, let us make a distinction between food insecurity and hunger. They are related, but they are not the same, because you can be food insecure and not hungry, but you can also be food insecure and hungry at the same time. So when we talk about food insecurity, it's a larger and broader concept, which includes both not having food, which we would typically associate food insecurity to, and the other aspect of food insecurity, which is very important, which is the anxiety or the uncertainty that associated with not knowing whether you're going to have money to buy food to feed yourself or to your family. So food insecurity has these two concepts. One is the psychological anxiety and uncertainty, and the other one is the actual fact that you don't have enough to nourish your body and your family. So to your second question, why is it a social determinant of health? This is a very good one, because when we think of social determinants of health, what we are talking is actually the root causes, right? The contributing factor to the health outcome. Many a times, or for the longest time, when we look at health, we only look at the manifestation of the disease or the health outcome. We see somebody who will get diabetes, so we will go in and tell the person, oh, you got to eat healthily, you got to exercise, you got to, do this and that. But the upstream factor, we call it, what contribute to the person not eating healthily, maybe because the person don't have food to begin with, right? So that will be the really social determinants of health, the upstream factor. So really, when we look at social determinants, we want to look at what really causes the downstream factor or the manifestation of what that present itself already. And food, access to food or access to healthy food is definitely an upstream factor. Circling back to the example that I mentioned to you, somebody who had diabetes, many of the times, the first thing we think of as a health educator, we say, hey, you got to eat, this and that, and you should cut down on this and that. But maybe the basic question is to ask the person, do you actually have food, right? Do you actually have money to buy food? Or do you have access to healthy food, not just any kind of food? Because that access to healthy food could be the really, really primary reason, the root causes of the person developing diabetes, for example. So in that perspective, we consider food insecurity really, really is the upstream factor, is the what we call the non-medical factor, the root causes that we need to examine first.
Thank you so much. It's really valuable input. Dr. Malik, would you like to please add to that?
Yes, absolutely. Thank you. And I agree with Dr. Eng in the sense that, food insecurity is considered now to be one of the leading nutrition-related public health issues in the U.S. And it's that term insecurity, and I'm so glad Dr. Eng mentioned this, the term insecurity itself, if we think about it, it's just so stressful. When you're insecure about really anything in your life, it's weighing you down. It's stressful. And so food is a basic need. And to be stressed constantly about where your food is going to come from, of course, that's going to affect overall health. And we find from research that, in fact, that's the case, that those who are food insecure, when compared to those who are not, they often have poor health. They have more depression and more severe depressive symptoms. Along with that, you compound that with those that are food insecure often have limited access to healthcare as well. And so it's kind of like this recipe for poor health, unfortunately. And we would think that eating nutritious foods would be a cheaper way to go, but that's not necessarily the case. When you think about where the money is spent, we can feed a family of 4 really cheaply through convenience foods. And sometimes being food insecure can lead to the consumption of calorically dense, non-nutritious foods, which will then compound the chronic health problem that we see in the US as well.
Thank
And
you, Dr.
it,
Malik. Yes, please go ahead.
I'm sorry, I think Dr. Malik mentioned a very important point, which I want to kind of expand a little bit. A lot of times, in fact, research has shown that individuals who experience food insecure, many of them actually are ended up having or developing chronic diseases, or ended up being obese or overweight. So food insecurity is a very interesting phenomena in the US, as opposed to developing countries elsewhere in the world. Um, for one very important reason, which I think Dr. Malik mentioned, in the US, the inexpensive food, right, the so-called unhealthy food, junk food, fast food are a lot more cheaper than fresh fruit and vegetables. And food insecure families or household or individuals, typically they don't have the money to buy fresh fruits and vegetables. So what happened? They end up eating a lot of food that's not healthy, but it's cheaper. So what happened is that we have a situations where people who are who are so-called relatively poor, who are already disadvantaged, they're ending up getting sick with diabetes, hypertension, heart disease, and being overweight and whatnot. So you have this cycle, we call it a poverty cycle, right? People who are struggling, facing poverty, they end up eating food that is unhealthy because they don't have the money, the means to buy healthy food. So they're food insecure, and that leads to many other chronic diseases. So it's like a vicious cycle that you're trapped as part of the poverty, vicious cycle. And in order to break that, we really need to deliver a very basic human needs to ensure that this food access is a human right rather than a privilege, right? That's enjoyed by only certain individuals in the society. So I think it's very important to understand that truly food insecurity leads to many health outcomes. Not through the choice of the individuals, but rather is a lot of times it's through no choice.
Thank you so much. That's perfect what you mentioned, how it leads to other issues as well. And that sort of gives us a segue to our next question. And if Dr. Ang, since you're here, you may want to answer that, is would you say food insecurity is a major issue in the Inland Empire here in California, and especially among our students?
To answer the questions, I have to refer back to, I have to always use COVID um, as a milestone. I think a lot of conversation today need to be somehow put it against the what we are facing today. Before COVID, I think in Inland Empire or in San Bernardino County, we have about 15-16% of the populations that are food insecure. I'm sorry, it's about 12%. So it's about 1 in 10 or 1 in 9. But after COVID, the number has gone up to 1 in 6. So the number of individuals over the age of 18 that suffer food insecurity has almost doubled. So we are looking at a lot more, thousands more people who are facing food insecurity. So it's a serious problem. And I don't have hard data relating to the students' population, but I'm going to say that it is not, it's not very encouraging either. Number one, because students do not have a steady income to begin with. We all know they don't have income. They are relying on part-time if they do actually work. So many of the students, I suspect, due to COVID, the number of food insecurity on campus has also drastically increased.
Thank you for sharing that valuable information, Dr. Malik. Please feel free to add to that.
Yes, thank you. I would agree with Dr. Eng in the sense that I don't know the hard data about Cal State University San Bernardino specifically, but we can maybe make some assumptions given what we see just throughout the U.S. and what we could see from county data. And we were talking about access to food, access to healthcare in the last question, but where we live and what's near our homes makes the difference. And that does seem to influence our eating patterns. And what we find is that in the county of San Bernardino, there are families, many families that live in areas where there are no grocery stores within walking distance. You add that to the fact that there's little purchasing power to purchase healthy foods, fresh foods. And now we've got kind of this perfect storm that's developing where there's going to be more reliance on convenience foods and fast foods. We do see data where in the Inland Empire, some agencies have referred to certain areas as high poverty, low access, meaning low access to nutritious foods. And they found that in the Inland Empire, 27 out of the 35 identified areas consist of populations that are mostly Hispanic. And what that is saying is that there does seem to be some racial and ethnic inequalities, that minorities, regardless of whether they were born here or not, are just often more food insecure. And so there is, again, this pattern of inequality. And so I would say that we can, again, sort of assume, given that CSUSB is a Hispanic serving institution, a minority serving institution, that many of our students may be experiencing this. And there was a survey that was conducted across the nation looking at college students in general. And they looked at community colleges and four-year colleges in 12 states and found that about half of the students they surveyed in this study were food insecure.
Thank you for sharing that. And while I have you here, I'll relay my next question to you. Is now that we got a chance to talk a little bit about students, what is the current literature that you may be aware of on how food insecurity impacts our students' success?
I think we have to sort of think about, well, what does student success mean? And it's defined in a number of different ways, but basically we're thinking about academic performance, whether they are retained, whether they drop out of school, whether they complete their degree. That's kind of what we're talking about when it comes to student success. And it unfortunately seems from lots and lots of studies is that food insecurity can lead to poor performance in the classroom, higher rates of dropout, delayed graduation, poor health status. There have been studies that looked at concentration, and students who are food insecure have more difficulty concentrating, lower GPAs. And so it does seem that students' overall well-being is absolutely affected by their feeling of food security or insecurity. And if their well-being is affected, then again, it would seem logical that their grades may be affected as well.
Thank you. And Dr. Ang, feel free to add to that as well.
Yeah. If you may, I would like to add a little more to what Dr. Malik said about the health disparity among the Hispanic group compared to other population in our county. I think this is a sad reminder of the health inequities that we are facing today, and it has probably COVID has, I would say, magnified the health disparities even more. in fact, there has been a lot of surveys and studies, not necessarily done in our county level, but the rest of the US have shown consistently that it is the brown and the black communities that face the health disparities even more after COVID, including food insecurity. In fact, there was a study recently, I wouldn't say recently, maybe about half a year ago, was released by US Census Board. They did they throw in one questions in addition to the traditional historical questions that they were asked in the US Census Board, and that question was particularly on health, food insecurity. And what they found was that the households, the Black and the Hispanic households, that experience food insecurity were about double compared to the white households. So if you look at a typical household of a parent plus 2 children, the Black households is about 1 in 5. And so are the Hispanic household compared to the white, which is about 10%. So you can see the health disparity is persistent, right, across the board, whether it's food insecurity or diabetes or COVID infection or the death from COVID. It has been very consistent throughout across the board, and that kind of brings us the importance of how do we address this health disparity. And I think it's important you mentioned about the social determinants of health. We really need to look at what are some of the root causes that lead to such a wide disparity. And I'm glad today we are talking about one of them, right, which is access to healthy food. So I think I kind of want to kind of highlight that because it's just so important for us to recognize that.
And if I may add something, we're talking about access to food. We want people to consume fresh foods, but something else that we need to consider is, do students have the ability to cook and store food properly? If they're food insecure, will they be able to know how to cook, what to do with those fresh foods once they've been purchased, and store them? So those kinds of facilities to cook and store is something else that could be an issue as well.
Thank you so much for bringing that. I think definitely the sources and resources available to students, that's definitely a factor to consider as we try to create initiatives on campus to help our students. And the last question to both of you, and Dr. Ang, I'll go back to you again if that's okay, and then Dr. Malik, you. As a last parting word, what would you want faculty, so us, to keep in mind about food insecurity among students and how that's impacting their success, their learning process, or in general, their well-being? And then if you need a little time to think of that parting word, feel free to do that as well.
I think the first thing will be to recognize that food insecurity is very prevalent, number one. And number two, it is important as faculty, as leaders, as administrators of an institutions, to create an environment where people feel comfortable to talk about it. So I think normalizing food insecurity is probably the first step. What happened is people associate hunger as what is the word? As an embarrassing admission, right? People don't want to admit that they are hungry, especially if you're an adult. A little kid has no problem to tell you that he or she is hungry. But if you're an adult, it's kind of hard to say, hey, I'm hungry, or I don't have food. And so we need to kind of take away the stigma that associate with food insecurity. And I like to call food assistance program as a nutrition program. That's how I would label it. So start changing some of the terms we use will be a good step, right, to create a welcoming environment for people to engage in the conversation. And once we create or remove the stigma, then it's easier to provide intervention. So I would say first thing is normalize it, make a food assistance program or nutrition program as available as possible in the campus, make the pantry a very welcoming place, make it tidy, look attractive. You know, I always feel like we need to give the best food to people, including people who don't have the means to buy it. Don't throw away all the dirty looking leaves and vegetables, right? We need to make our pantry as decent, as presentable, as classic as possible. And put posters around the campus, talk to people, educating our students as well as ourselves the importance of good nutrition to good health to student success. I think those are the so-called tools that we can make use and display throughout the campus to create an environment to our students, to ourselves, that is okay, right? It is a problem, it's an issue, but you know, we can solve it. It's not something to be ashamed of.
Thank you so much. The discussion about stigma and reducing that, that is definitely key. We've seen that many students who may be aware of the den may still not go because they're concerned about what that is perceived at. And we've tried to go around that, but you're right. Normalizing the conversation is very important. I appreciate that. Dr. Malik, you have the last word.
Completely agree. There is a stigma, and it's totally understandable. It's absolutely understandable that there's a stigma with this, and I know there's some studies that found that food insecure students were actually less likely to go to campus assistance programs, possibly because of that very stigma attached. So I love the idea of just kind of rebranding it and making it more normalized. Absolutely. I mean, the fast food industry is so successful because it's quick, it's cheap, it's easy. What if we could use some of those quick and easy ideas for our own food resources on campus for food insecure students? I mean, I don't know if anybody feels super embarrassed to be in a drive-through, at a fast food restaurant. They're probably excited to get that food. Can we make that kind of excitement happen in a way so that it's not so stigmatizing, and it's something that can be relatively quick for them to do, and of course it's going to be inexpensive to them but readily available. So I think if we can almost mimic the fast food idea in industry and make it just easier for students to come and use those resources. And I think as faculty, being aware of those resources, I don't know how many faculty are aware that we have these resources on campus for our students. So if we can point them in the right direction, I think that would be a huge help too.
Thank you both for your wonderful ideas and the information you shared. I know our audience would be delighted to hear and also learn a lot, so we can create an inclusive classroom for our students so they can succeed. And I appreciate the Center for Health Equity on this collaboration with our faculty development opportunities for our faculty, as in that includes our graduate students, many of whom play both roles as faculty and students. So this is absolutely appreciated. And we will end right here. Thank you.